All right, and we are live. Hello, everyone. Welcome, welcome, welcome. Happy, magnificent Monday. Welcome to Wellness Chronicles with Aaron Wells. And as you can see, it says Wellness Chronicles with Aaron Wells. I love you, everybody. I hope you had a great weekend. And thank you for coming on board to hang out in our conversations. As usual, we have a wonderful panel um, of conversationalists, two queens who I know. Clyce has been on earlier previously, and Gail's coming to us all the way from Philly. They'll be introducing themselves in just a moment, and we'll be talking about some important things dealing with community. Um, I hope all of you buckle in, join in on the chat. Please give your opinions, your thoughts. Let us know that you're there. Say hello to us, and we love you. We appreciate that. Wellness Chronicles: Conversations Exploring Injustice and How to Ignite Sustainable Change. That's always the key for me, right? How do we not just explore what's going on, but how do we ignite? How do we launch? How do we begin to create the sustainable change? Not change for the sake of change, but change because there's a reason to. And where there's injustice, there's always a reason for change, right? And so, how do we ignite sustainable change while embedding wellness, in marginalized communities? As I share every week, the marginalized communities that Wellness Chronicles address are the Black community and the communities of Black people throughout the United States, but specifically in the Charlotte area. But we're all connected, right? And so you might call it Philly, you might call it Charlotte, you might call it Detroit, you might call it Birmingham, you might call it LA. But in reality, we wake up and we're Black and we still deal with the same issues from coast to coast, from Canada to Mexico. And so what we want to do is have the conversations that begin to move agendas forward and allow us to see change. And so I want to thank my guests for coming on tonight. I want to thank you for coming in. Please make sure you share on your social media platforms. Please go to the Promise Resource Network Facebook page and like us so that you can get notices about all of our classes and our conversations. And then if you would go to our YouTube channel, Promise Resource Network YouTube channel, subscribe. We are trying to aggressively get 10,000 viewers by April 1st. And we know that's aggressive, but we swing for the fences, right? And we want to be able to get the word and the messages out about wellness and recovery in all communities. And Promise Resource Network is that vehicle. So if you could help us by subscribing to our YouTube channel and liking our Facebook page and sharing all of our classes and programs. All right, so here we go. I want to bring on my guest as we begin having conversations tonight. I'm going to bring in my buddy on the bottom tier there, Clysha. Clysha, if you would introduce yourself, tell everybody who you are and why you're hanging out with us tonight. You're muted.
This is the only thing. I didn't want everybody to hear me typing, but my name is Clysha, and I am a doctoral student at UNC Charlotte, studying health psychology with a community focus. And so this is right up my alley, and I'm just, happy to be here and talk about community health as it relates to our community.
Thank you so much, Clysha. And Clysha has been on and will be a regular for Wellness Chronicles, and she'll talk about some of the things that she's doing as we get into conversation. Our next guest is a forever friend, my buddy Gail. Gail, come on, introduce yourself and tell our folks what's going on with Gail.
Well, my name is Gail Burwell Day, and I am the director of the Wellness Initiative for North Philly Project, Aaron Wells. I also am the owner of Fit and Fabulous, which is a company that focuses on wellness from all aspects. We do a holistic approach to wellness: food, nutrition, exercise, any type of wellness. We're involved in that. I've been dealing with individuals who have had any type of issues you can name. From it used to be called MHMR, now it's called intellectual disabilities. So that's one of my things I've been doing for many, many years, but also doing a lot of work in the community, trying to help the community to be a little more healthy. So that's the focus, health.
Yeah. Gail, I appreciate you coming on and taking the time. And I want to let the whole world know she canceled an appointment to play tennis today, working on her physical health to come on board at the last minute and chime in. But really, seriously, thank you for all that you do in community. You help a lot of people. And so tonight we want to be able to continue conversation. Our last month we talked about reentry in the Black community and what we find are connectors, right? In community, all communities, but specifically for us in the Black community, our dots connect. And so when we talked about reentry, one of the issues of reentry is healthcare, because we have so many men and women returning with no health benefits. And we have so many men and women returning with issues that, while incarcerated, that were not properly addressed. And so because of that, we then bring, from an economic standpoint, a whole group of people that add to and continue to expose the disparities in healthcare. And so we decided, let's take March and let's talk about healthcare in the Black community and what that looks like. And so we want to be able to talk about the disparities of healthcare tonight, and what that looks like. It doesn't look like a thing. There are several things connected to the disparities in healthcare. And so just want to be able to talk about it. Want to say hello to my young queen, Kristen, my daughter, and who's on. And so we'll be checking in with all of our folks on chat tonight as we are as we're going through conversations. So, ladies, let's talk about that. The disparities of healthcare in the Black community, what that looks like, how that has been revealed to you, even as you study community and engage community. Chrysler, Gail, you've worked in community for so many years, and from a personal perspective, dealing with some things that expose disparities in Black communities. So let's explain it. And if it's okay, I'm gonna start with Chrysler, and then we'll come over to Gail for this one. What are some of the health disparities that are experienced in Black community, Chrysler?
Well, I like to explain disparities by the 4 A's, and that is accessibility to adequate healthcare, acceptability, so that stigma associated with it, or that acceptance associated with going to seek help in the healthcare, and affordability, and why is the last A leaving me? Access, affordability, acceptability, and I think it's like accountability of people who look like me.
Accountability would be the one.
Yes, I don't have people who look like me in those spaces. And so I feel like those are just the general disparities, but they are exacerbated in the Black community, and especially when we talk about access and acceptability, because our trust for healthcare disparity, healthcare industries are really lacking, and not and with good reason, because we've been historically, discriminated against and oppressed in these systems. So we don't really turn to those systems as the first thing to get help. We try to handle it on our own. And I think that's just, it's becoming apparent that that's kind of adding to the poor outcomes we see in our community.
One of the things you talked about as far as our accountability, even from our perspective, right, that I was sharing this in conversation this weekend. When I tell people I'm going to the doctor, the first thing we ask is, what's wrong?
Mm-hmm.
Nothing wrong. why nothing's wrong. I go to the doctor regularly to be able to understand, as part of my support, how to navigate life, right? Is how to shape my life in such a way that I create a healthy environment. And so that comes from that place where we are skeptical about care. And that comes from that place where we see the doctor as something that I go to when I need versus as a part of building healthy plans. Gail, for you, explain healthcare disparities experienced in the Black community from your vantage point, from your experience.
I think a larger issue is there needs to be advocacy for the Black community. There needs to be someone who walks beside you as you go if you really don't feel comfortable with demanding answers and not allowing people to just talk at you. And I find that a lot of doctors will talk at people because they assume that they just need to speak and you will just listen and do what they tell you to do and not say why, what's the alternative, what else can I do? They don't expect you to question that. It's just an assumption that I will speak and you will just follow what I say. And I think that comes from just them not knowing the community, not understanding the community, and not caring enough about the community. So they feel comfortable just dismissing the community. They will write you a script and not really know your name, have to look at the chart to figure out what your name is. I find that a lot of them are in the moment. So your past history has no impact on what they do in the moment. They're just dealing with you right now. Don't ask a lot of questions because they're not really concerned. And they make it evident. So unless you really are the type of person that really confronts them and says, stop talking and explain this to me because I don't understand it. And a lot of people don't feel comfortable with that. And they know that, and they understand that dynamic for the community because the community does feel out of place and not sure, and I don't want to sound like I don't know what I'm talking about. So, so it's a funny position for them to be in because you don't know what to say. You don't know what questions to ask. So you have to be, you need an advocate. I really am a firm believer. Short story, my mother just had her second stroke in 4 years. So I've had the unfortunate opportunity to be in the healthcare system on a level that is unbelievable. And it forces you to say, why, no, don't do that. And that's not acceptable. But I can understand how you feel when you're going in there because it's a battle. It's an actual battle with the healthcare system and the doctor who assumes that you think they know everything when they don't, and that you don't have the right to question them because they sort of take it as if you're sort of trying to take over the healthcare of this individual. Whereas I have the right to speak, I have the right to question, and if you feel as though you can explain to me properly, then that's what you need to do. So I've been kind of forced to really speak for someone who can't speak for themselves. And that's what I think we need in the Black community. We need some people to speak for those who don't feel comfortable speaking for themselves. Not that they can't, they just don't feel comfortable. So allowing them the freedom to say, whatever your question is, doesn't make a difference how you ask it, you still need an answer. And empowering them to be able to go to the healthcare provider and demand proper service and not accept whatever is just doled out to them because the healthcare system is overwhelmed. They are absolutely overwhelmed. There are too many people who need care and too few healthcare providers, just plain and simple. So if they can just dismiss you, they will. So that's what I see in the community. And it's not just about, unfortunately, it's not just in the African-American community, but it's just exacerbated in the community because we're coming with bigger problems because we don't go to the doctor regularly. So by the time we get to the doctor, it's at stage 4. It's at a critical stage now where things have just gotten out of control. And if we can kind of encourage people to see them regularly, but find one that you feel connected to, that you feel a connection with, that you can kind of say, I can talk to this individual about me, and they will respect what I say and my concerns.
That has a lot, and thank you for that, because that has a lot of truth all interwoven there. I went to a pain clinic trying to resolve some issues about 2 years ago. Well, it had to be 2 years ago because 2020 took care of itself the year before last. And I remember walking in, and the doctor walked in, literally flipped through my chart. He wrote down what he thought was wrong with me, handed it to me. And I remember what he said. He said, we can do surgery on your back or we can give you shots. I have never seen him again. And if I do, I will never know his name or his face. How do you just walk in, you look through my chart, you don't know my name, my favorite color, my favorite basketball, you know nothing about me. And except for what you just read. And these are the things that happen, not just in this system, but the legal system and others, the education system. I'm going to read this chart. Mm-hmm. I don't know you, but I'm going to tell you what I think is best for you. And those are some of the issues that happen in our community with healthcare, right? A lot of it has to do with we have no relatability and there's no real vehicle for communication. You're not hearing me. I don't understand you, right? And so how can communication really doesn't take place until understanding happens? There was no understanding. And so that is also a great disparity in our community. Clysha, as we explain and talk about the disparities out of the A's or anything else, what do you see would be the most pressing of the disparities? And I would imagine, again, this is Gail and I was speaking earlier, I used that whole elephant analogy. This is an elephant, right? So I don't know if we're talking about the tail or the horn or whatever the elephant has. It's a big elephant that we're talking. But if we had to say that this is the most, what would be the largest disparity or the greatest disparity in the Black communities concerning healthcare?
I would say it's really speaking to that acceptability part and the accountability. Those two work together because not only do I mean stigma, I mean the knowledge gap too, between like knowing that, oh, I can go to the doctor just to go. Like I can go for prevention and not actually when something's wrong with me. And then when I do go, I can go to somebody that looks like me and say, you know, yeah, I went to the cookout and I had too many burgers and blah, blah, blah. And they really understand like, okay, that, you know, Black culture is like they can really pick up on those nuances. And I think that is really where we could start seeing a change, because I don't think it's not that people in our community don't want to get healthy. I think it's like we don't know the mechanism to go about it. And if we do, speaking to Gail's point, when we do go in the hospital, they just talk at you and they're not really trying to focus on prevention. The healthcare system is geared by what we call the medical disease model. So it's literally you come in, what's wrong with you? How can we fix this? Not how can we prevent it from happening again, or prevent, okay, your hypertension. How can we prevent this from turning into a stroke? And a lot of times they're just telling you, oh, you just eat better, just work out more, and then send you on your way. When it really takes a lot more. Again, speaking to Gail's point, it takes an advocate to walk alongside you and really reinforce what exactly that looks like, what exactly getting healthy or changing your diet looks like. Because just increasing veggies and cutting out meat, that's like telling a Black person you can't come to the cookout, and that's not what we want. So I feel like we have to figure out new ways to, inform prevention.
Absolutely. I want to thank you both. So I want to go to this because, and I want to start this one with Gail. So as we connect, and I'm grabbing hold of the advocacy part, Gail, because that's so much of what we do in my career, in my profession. But it is important, right, that someone walk alongside, and you experience that personally, what's going on with your mom, that someone walk along beside. I just got some blood work back a couple of weeks ago from some tests. And when I went to get the blood work from my VA doctor and take it to my private physician because they were addressing the problem, I couldn't read it. I had no clue. They basically gave me some paperwork that could have been Russian or Chinese or it's just a Martian, a language I did not speak. And so for me to take it to the other doctor, so that was basically a doctor talking to a doctor, but in the middle was my life.
Right.
And so I went back and, okay, I need you to take line by line and tell me what this test means and what this results mean. Could you imagine for people who either weren't as inquisitive or people who didn't understand that you have a right to understand what that would mean, that this is happening and there's nothing to do about it? So my question begins with this, Gail. What is our role in the Black community and responsibility in creating some change that we're addressing? We know there are the disparities, and we understand that all systems, many of the systems, I can't speak for all, I don't want to overgeneralize, but many of the systems simply aren't geared or considerate of who we are as Black people, because we are. That's just who we are. And it's a great thing, but they're not just always considerate of us from a cultural standpoint.
Right.
All right. Now, with that understood, that's a given. That's the toothpaste out of the tube. We got that. What is our role, though? Because we must play a role in our own lives. We must have some accountability and responsibility in our own lives. So, Gail, what is the Black community? What is our role and responsibility in creating change in healthcare for ourselves?
First of all, the first thing is to say why. Why? And just keep saying why. And the fact of the matter is, the doctor can't explain it to you. It's not your fault. It's his fault. If you're the smart one, you should be able to explain anything I ask to me. And to you.
I like the way you put that.
So it's not my fault. I don't understand. It's your fault. So, and the thing of it is that about healthcare, the system is not about curing. It's about treating. Healthcare is about treating. They're there to treat. If everybody was cured, they wouldn't be there. So they're in the practice of treating things and not kind of managing them. And to your point about doctors who say, exercise more, eat more, we have to understand the limitations of doctors. A foot surgeon cannot talk to you about the brain. Do you know what I'm saying? That's out of his scope of service. Your GP can't talk to you about nutrition because that's not what he does. He can say broadly, eat better. He can say broadly, exercise, but that's not his expertise. And if we understand their limitations, then we understand that you really can't speak to that. You can send me to a specialist to speak to that, but you can't speak to that. You're a GP, and some things are out of the scope of what they can do. That's why they say eat healthier and exercise. That's blanket. But they don't tell you how because they don't know how. And we have to understand what they don't know and just put it in that perspective that you don't know. And so we have to be able to help our loved ones, our family, our community to say why. What's the alternative? What can I do different holistically? Make them think about something as opposed to just automatically writing you a script, because that's what the pharmaceutical company wants them to do, just keep writing scripts. And so that's why they write them before they know you. My experience the last time, I had a neurologist come to me, my mother's there, and ask me why my mother was on a certain medication. She said, why is she on this medication? As if I wrote the prescription, which is ridiculous. I said, because obviously one of your colleagues wrote a prescription for it and felt as though as a team of neurologists that that's what she should be on. Are you saying she shouldn't be? And she said, well, no, she shouldn't have been. Well, isn't that disturbing? Do you know what I'm saying? That's disturbing. So that's how unconnected they are. And you're asking me. She didn't read a chart. Now, the charts are all electronic, so you don't have to pick up a piece of paper. They don't read a chart. They come in and they ask you what's wrong with you. She's asking me why she's on medication. So you need someone who can say, why are you asking me a question that you should know? You're asking me a question that you should know. You should have looked into this before you came to me and answered that question for yourself, instead of asking me a question that if I weren't here, you'd be asking my mother? That makes no sense. She's had a stroke. She can barely walk. That's what they do. So when you can't speak for yourself, they just start writing things because they have no information. They just make it up and they just start writing things down, and they continue on the process. And the next person doesn't pick up a chart, just looks in the moment and says, what's wrong with you? If you can't describe what's wrong with you, they make it up and they give you a script. So we have to be able to stop the process by saying, when they say, well, you need this, why? Why? What is that going to do? What are the side effects? And what if this doesn't work? What's your next plan of action? What do we do after that? But it's a why. It's a why. And also, when they go to write you a script, it's a no. 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 What's the alternative? And you make them work to say, well, you need to do this because of this. You need to make them explain to you what's going on, because they're supposed to have the information. And if you don't feel comfortable, you stay and you press. I still don't understand. I still don't understand. And you say that until you understand, until you truly understand, where you may have to kind of work with it and kind of go, no, I don't understand. Because they try to push you through because they don't have time. They do not have time. They're trying to see so many people in that time period. It's just like that. Quick, quick, quick. It's why and it's no. If you say no, that forces them to do something different. Now I have to kind of spend some time trying to convince you why I'm telling you to do this. And most people just take the script and walk. Or they get information like you did, Aaron, and they don't know what it says. They don't understand it. I advise people to Google. I love Google. If there's something written, they will send you your records. If you Google, what is this? You'll get some general idea of what it is, some general. So then you'll know when you go, that's no. And they don't want you to Google anything because then they feel as though, well, people Google or WebMD. They don't want you to go to WebMD and get information because you need to hear it from a doctor. But I can still get an idea of what's going on. So now you really have to explain it to me so I totally understand. So it is doctor to doctor because it's easy for them to communicate, but because it's just paper. It's not people, it's paper. So when you put the people out of it, that's when it goes wrong. Everything goes wrong. That's why they have so much malpractice insurance. Remember that.
Chrysler, so jump in with that. The roles and responsibilities for us to create our own change, knowing what those disparities are.
Well, I do want to just give a shout out to Black women in public health care because they are rampant in the United States. And I think they're doing great work in changing what, the Black community looks like in terms of healthcare. But what we can individually do, I think, similar to what Gail said, like question really what is being told to you and look up information, talk to other people about information. And I think one aspect is, how do I want to put this, really understanding that you're responsible for your health. But at the same time, there are certain systems that do it. There are certain places that do it better. So if you're a primary care doctor and you find out that they're not doing it right, look up where in your network you can go to say maybe has integrated care. And integrated care is really taking over in terms of trying to have the doctor, the nutritionist, the psychologist all in one place. Try to look for things. I would look for more forward-thinking doctors' offices, and especially if you have, Medicare or Medicaid. I mean, you can go anywhere pretty much that they will take they're going to take Medicaid or Medicare. So, it sometimes it's a little bit on the expensive side, but I think there are a lot of places that you can find integrated care at a lower price, especially in Charlotte. I see that it's a lot more free clinics that are more robust, not just, one doctor, but has a full team. So just more so looking for better and not accepting what is given to you if you feel like it's not enough.
I thank you for that. I just want to grab some of the comments. Besides Kristen saying we're the beautiful people. But prevention is the key in speaking and to that fact. Lisa's on. Hey, Lisa. A deeper look into the why, addressing what you said, Gail. It's more than just a food change or start exercising. How the trauma of it is real, and there is a trauma that's attached to being dismissed all the time, right? That I show up to the doctor and the doctor's very dismissive of me. Even to the point that, you're not even giving me eye contact. You're looking at charts. You're talking to me. You're talking at me as if I don't even exist in here. Before I know it, you're giving a chart. You don't even say goodbye to me. You just walk out and begin giving the nurse, instructions toward me. And so that being dismissive in and of itself is a trauma that makes me not even want to go to the doctor, especially when everybody else has dismissed me. Now the person who I've been taught should care for me dismisses me also. Another thing about our community, and when you talked about the integrated care, Clysha, I actually worked at the Good Samaritan Clinic in Morganton, North Carolina, and it was integrated care, and it worked. It worked so well. It was our folks up in Burke County. And so we're talking about low income people. They were predominantly white. There were people of color, but they were predominantly white, but they were low income folks. And poverty is poverty. And so as they walked in, I was there as the peer support specialist. So you had someone with lived experience to help you connect and help you figure out and think through things. We had psychiatrists there from Broaden Hospital, which was right down the street. We had nurse practitioners there. We had a doctor who was there. We had a dentist who was there, right? We had a chapel on site. And it was amazing to watch how people connected the dots as far as their care. The nurse would literally send people whose blood pressure was high to me to be able to help them talk about their lived experience, right? Instead of just throwing medication their way while they were waiting for other parts of the appointment. And if someone had some intestinal things, the nurse would look at their mouth and say, you know what, you also need to see a dentist, which it truly was integrated and connected care. And as you spoke about that is one of those solutions that would help in community because of the fact that, as Gail and I talked earlier, mental health is so connected to all things in Black community. And we need to be able to address as we're going through and be able to connect those dots in integrated care. As we finish, or not finish, but as we wind down this part of the conversation, anything else you can think of considering roles and responsibilities in community, right? So we need to become more informed. A lot of that has to do with media. We see a lot of commercials about medications and their side effects. We don't see a lot of commercials about preventive. We don't see a lot of commercials about gardening. We don't see a lot of commercials about healthy eat. We don't see those things that would help us. We do see because pharmacy has the money to be able to saturate media. Besides media and being able to change narrative for us, anything else you could think of as far as the role of Black community as far as their own care? Tough question sometimes, right?
Yeah. You know what I thought about though, just thinking about those, like when you think about wanting to exercise more or improve your diet, you don't really think about, okay, 50-year-old me is going to thank me, opposed to today, I need to do something today. I think I try to think about health in a long-term objective, and I think we in the Black community should do that. We should learn that we should give way to thriving. Give way to thriving instead of just surviving day to day, and really understand that our health is one of those things that we can thrive at day to day. We don't have to be perfect every single day, but throughout, you just have to want that 50-year-old you to be like, I'm thankful that you exercise at least twice a week because now I don't have that back pain, or I'm so thankful you cut out the salt because now my hypertension is low, but you still ate good. You still, I keep bringing up the cookout, but you still went to the cookout. You just didn't, get as much chicken. You modify, because what we have to realize is a lot of these health disparities that we are at the top of, some can be explained by genetics, but a lot of it is modifiable risk factors. Now, granted, there's some things we can't control with the systemic racism and the structures in place that, make our neighborhoods the way they are, but we are resilient people for a reason, because we look at a challenge and we say, all right, let's do this. So I think for health, it should be no different. That's something that even with these food deserts, we can figure out a way to be healthy and figure out a way to push our community forward. And I will say another solution that's going on in Durham, in Raleigh, North Carolina, they started a Black farmers market. By Black for Black. And, everybody's welcome, but this really arose out of the pandemic and wanting to make a way for Black farmers that have been impacted, but also bringing food to these known food deserts and fresh food. And that, you know, and I think we have to get more into the idea of cooking like healthy foods that can still be good, and knowing that like you can cook up kale for it to be good, or you could make collards and it not have as much salt and it be banging. You just gotta figure it out. And I think we should welcome that with excitement. And that's the mental part. That's the mental part of trying to accept that, okay, this is going to help me. And so how can I make this exciting and fun? Not, I gotta go to the gym today. Like what is fun about it? And stick and hold on to it like your life depended on it, and just keep building one step at a time. You know, stress is going to impact that a lot, but I think overall we can have that agency to just be excited about getting better.
The reason I'm grinning is because you heard the expression music to your ears. You was just music to Gail's ears. And so
right? Everything else.
We had this conversation earlier today, going back and forth. And I'm telling you, Chrysler, it was like you eavesdrop on our conversation. You said, Gail, I'm going to tell him exactly what it is that you mean. So you was just music to her ears. Gail, chime in, talk about the responsibility of community. In spite of the things we don't have, there are some things we can do. We don't have to continue to live life or start life in the Black community from a deficit. There are things that we can do. So Gail, go ahead and piggyback on and continue that conversation.
Thank you so much, Aisha. Yes. So refreshing. We do have to do incremental changes. I mean, nobody's going to go from eating fried chicken and Popeyes to being a vegan. That doesn't happen. You're going to make a small change, and we just need to be patient with ourselves in making these small changes. So you try something. If you don't like it, try something different. It doesn't have to be quinoa. I mean, it doesn't have to be blueberries. It doesn't have to be that. I don't like blueberries. I just don't. I've tried them every which way. I don't like them. So I don't eat them unless I put them in a protein shake. So you don't have to eat everything that they say is good for you, because if it doesn't taste good to you, you're not going to eat it. That's just the bottom line. I don't care what it is, how good it is for you. If it doesn't taste good, you're not going to eat it. So it's really about showing how to make different foods taste good and how to eliminate certain things. And information is power. It really is. And if you understand what certain chemicals do to your brain and your body, then hopefully it will make you kind of think twice. You know, you'll think, it does taste good. Sugar is unbelievable what it does to your body and how addictive it is. And that's why if we start with our children, if you never tasted it, you never miss it. So if you never gave your child something, they never miss it. We have a child that we've been working with who's never had sugar, salt, was really raised on vegetables, whole foods, no seasoning. I remember when I first made something for this child, someone asked me, did I add salt or seasoning? They don't know salt or seasoning. They don't know it. Unless you adulterate the taste buds, you don't know what it tastes like. You know, if there's certain things you've never eaten, somebody was like, what does it taste like? You don't know. You have to go, I don't know. I've never had it. I don't know what it tastes like. Exactly the same thing. If we start looking at the fact that we adulterate our taste buds as early as birth, you know what I'm saying? They start feeding you salt, sugar from birth. So if you kind of look at trying to change that dynamic and looking at eating a little differently, like your grandmother fed you or your great grandmother fed you, you know, oats and things that are just basic, nothing fancy, just basic. Oatmeal. Oatmeal was just a staple. You had oatmeal in the morning sometimes, just a staple. Didn't have to be with fruits or anything, just oatmeal. And if we can just do simple little things and build on them, you're not going to go to the gym. You know, if you're not going to the gym now, you're not going to go 7 days a week. My thing is go. Just go. And I don't care if you go in the building and you stand there and then you turn around and leave. Next time you go in the building, you might sit on something and do something. It doesn't matter. Just be in the building. And that will start to give you energy to kind of keep going back. And find something that you, like you said, like something that you like. If there's an activity that you like to do that. You like riding a bike? Ride a bike. You like to walk? Walk. It doesn't have to be you go in the gym and you're pushing up, weights. It just has to be, you have to do something that your body wants to be in motion. It just does. It wants to be in motion. They say sitting is the new smoking now, because it is, because we sit all the time. The pandemic has shown us how much we sit. Now that was the pandemic 25 or the pandemic 15, because people were sitting hours on end doing nothing, or in front of the tube, or in front of the TV, or on their phone. Sitting is the new smoking, so we just have to move. Whatever you do, people like Zumbas, people like a lot of different things. Just do something, whatever you like, and that's a start. But you gotta, like you said, you have to build on every success. So if you go to the gym once, great job. Aaron's ready to move on.
Well, no, you actually you took us there when you inserted COVID, and we've heard about the exposure of the healthcare disparities in the Black community. They always existed. COVID just amplified. And so when you mentioned COVID and sitting being the new smoking, just wanted to go there. So specifically concerning COVID, has our attention focused on healthcare disparities created any improvement? So we since June or March of last year, right, we focus on what's happening in the Black community or communities of color, but specifically the Black community as far as COVID, right? So the disparities look so much wider now because they're under the microscope. But have we seen anything different either from community or toward community? And I want to start with you, Clysha, and work my way back to Gail. Have we seen any improvements from community itself or toward community from the systems concerning healthcare that COVID has exposed?
Well, I can definitely say it exposed the racist systems and how, it's inherently racist in that you can always see how disparities are exacerbated during pandemics among the groups that are already receiving the highest rates for the disparities, which are people of color, primarily Black and Latinx communities. And so I think, if anything, that's what COVID just brought light to again. And it felt like a perfect storm along with the protests, even though as Black people, we've been dealing with this for generations. We can all speak to this. This is no surprise, but apparently it was a public outcry in America that really got people moving. And I just hope that this momentum lasts. But I think that all eyes are on how these systems are, inherently meant to impact others worse than other groups, worse than others. So, however, yeah. So yeah, I just think that has been brought to light a lot, and hopefully the momentum continues, and all these efforts to improve and to work towards dismantling what's wrong with these systems continues, because usually we see a big, robust backing, and then it kind of goes quiet. So I think for us, we just got to keep the noise loud and keep banging down the door at the issues that impact us most.
Thank you. Gail, chime in. So specifically concerning COVID-19, we know the attention has been nationwide, right? It's been, here's what's happening. Here are the disparities. This exposure has it created anything from community in and of itself to be able to say, oh, we need to fix this, or toward the community from the system saying, how do we now improve on these things that we've seen?
I think the community was made more aware, even though we knew. It was right in your face. It was just like a bat to the face. It wasn't subtle. There were so many African Americans that were dying daily that you had to take pause and go, wait a minute. I knew it was bad, but this is atrocious. And then the quote unquote system and other organizations that were sensitive to the fact that now all of a sudden they woke up and said, oh, wow, is that really going on? Have offered to fund programs that will feed back into the community. So I think that's some of the outcome from the pandemic, is that there are now organizations that are saying, oh, wow, we didn't know that was going on, but we want to support anyone who's trying to do something to lessen the disparity. So I think that's the good piece that came out of it, if there's any good pieces, which is now we have an opportunity perhaps to take more back to the community, to provide more services to the community.
Okay. Go ahead, Clysha.
Oh, you just made me think about how when you said like Black people are just dying at crazy rates, though I've recently learned the number one underlying health condition most reported was hypertension. And who's number one for hypertension? African American. So it all fits together. And, you know, I just really want these improvements and these advocacy efforts to continue, because a program for 1 year is not going to change anything. Like these programs need to be funded for multiple years, and they need to be shown that they work, because a lot of times, every time this happened, they put a program in place and nobody checks. Like, are they actually changing people's lives, or is this just a way to give people jobs? You know, so I hope it's real change that comes.
Right. Sometimes it's a way of just kind of quieting the community by throwing some money at them. They said, we'll throw money at them. Said, see how we care. We'll just throw this money at them. And what you do with it is fine. If there's an outcome, fine. If not, we tried. So you're right. You need to have some outcomes. We need to do sustainable kind of programs where it's not just in the moment. Because now we're just in the moment now, and people are in uproar going, oh, I can't believe this is going on. But then, you know, people have short attention spans. They just do, especially when it's not them. So their heart goes out to you for the moment, and then they're on to something else. They're on to their lives because they're not affected that way. So I do think we need to build on the momentum and keep it going, and really demand that if you funded us this year, you need to keep funding us, because we can't resolve a systemic problem in a year. That's impossible.
Exactly.
So you need to just continue to fund us until we can make some headway. It's not going to happen in a year. It can't, nothing. You can start the process.
I was just going to chime in, Gail, and part of that is then, because you're absolutely right, according to our consideration, you're absolutely right. But that other part is that once there's funding for that, there's this saying, nothing about them without them, right? So we have these people who come up with the ideas and the thoughts of what's best for you. Right. And so we'll throw money at that. Wait a minute now, this is a great idea. Glad you got the money. Here's what we believe is best for us. And so now there must be the inclusion, if it's going to be sustainable, of what is best for community from community, right? So many things have been started. So many things have been launched without a consideration of what I think is best or what I know is best for me. Clysha keeps bringing up the term, which is so applicable, the cookout, right? Which when we look at this, there are certain dynamics that belong to my community. There are certain dynamics that belong to my culture. That must be included as you're thinking about how to fund and what to fund, what is best. So again, thank you both. That piece about I must be included in understanding, nothing for me without me. You right. you can't do that. And so that conversation continues. I want to come here for a minute, if you don't mind, because we have about 10 minutes. This piece right here, right? I'm one of them. See these grades? I'm a baby boomer, right? And so as I go to, like I said, I'm one who stays on top of my health. Pretty much best I can. I guess I could do that. It's not the best I can. I could do better, but I'm one who tries to stay on top of my health as a lifestyle. And a lot of it has to do with the fact I'm getting older. And I didn't, Clysha, think about the 50-year-old me. So I know I didn't think about the 62-year-old me when I was out there. But I'm very attentive to this. But there are some gaps, right? There are some gaps about aging in the black community. Our baby boomers are getting older, right? And so what gaps do you see? Gail, we're talking about some of the things your mom is going through. What are some of the gaps that we see facing our seniors and our aging population according to the healthcare the healthcare systems? What are we seeing that our older folks are facing in the Black community concerning healthcare? I'm gonna start with you, Gail, if you don't mind.
What we're seeing is the fact that they feel as though you're disposable. If you're over 55, they feel as though, you lived a long life. There's no energy around helping you to weather the storm as you get to an older age. The healthcare field just feels as though at a certain age, what do you expect? And that's the way they kind of treat people. So the seniors and the baby boom and the aging population, they're not getting the care they need to really continue to sustain their quality of life because they're being written off. They just don't care about the aging population. If you're 17, okay, they feel as though you have a whole life ahead of you. If you're on the other end of that, they feel as though you've lived your life, you've had your chance. So there's not as much energy. They feel as though now you should just go somewhere and sit down and just wait to die. But there's no energy around helping that person to live a good quality of life. I don't care if they're 100. It doesn't matter. You still put the same energy in if I'm 85 as if I'm 8. You put the same energy and effort in for my quality of life. And that's not what happens as people age. That's when you really need your advocate right beside you to run along with you, because that's when they really just kind of shut it down. They just shut it down. So that's what's happening to the Asian Black community. They shut you out. They just shut you down. They don't even really consider you.
Clyde, you jump in. Thank you, Gail.
I think, Gail, you're speaking to such a good point about that quality of life, because a lot of times their focus is quantity. You're living another year. That's good. But it's not really what are the indicators that increase quality of life for the older community. And right now, that's really where the gerontology field, I think that's the right name for older psychology. Yep. So they're really trying to understand what are ways or prevention areas that we can improve quality of life in terms, not just improving them to last another year, but are they going to live a good quality life? And because right now that's just not important. And I don't know why. That's again, it goes all the way back to why prevention is not the most important thing. But of course, when we talk about who runs the world, it's what makes money and prevention. But it seems on the front end, prevention doesn't make money, but prevention actually could save a lot of money. And I think we don't look at it like that because it's not the right now. Like I can't see the money savings right now, but I think prevention is, again, key.
Prevention actually could save a lot of money. Gail, jump in.
I was just going to say, you're either going to pay now or you're going to pay later. Mm-hmm. With health, you either pay now or you pay later, but you're going to pay. So when people say, oh, that's too expensive, or sometimes people say it's too expensive to eat healthy, it's too expensive to buy this, you're either going to pay now or you're going to pay later with co-pays and bad care. You're going to pay some way. You're going to pay. So which would you want to pay for?
Yeah, that's absolutely true.
I just want to add too.
Jump in.
Sorry, I just want to add too. One gap is like, I find that sometimes when you get older, people feel like you can't reverse certain things after a certain age. It's just like, it's done. Right. That is so far from the truth. And I will even just use an example. My grandma went to live in Hawaii, and she walked with a little bit of a hump. And over time, just walking more, access to better weather, water, she just over time straightened up a little bit. But she came back here and it slowed down a little bit. So it's like it can, and she's she's older. So I just thought that was amazing to see that, you don't always just have to accept how you're feeling right now. There's always ways you can improve even in older age. Mm-hmm.
Environmental health, and this is again just chiming in on conversation that Gail and I had earlier. As we must connect the dots, right? So mental health and environmental health are important dots to connect to physical health. my atmosphere, my environment. How conducive is that to feeling well? Because it's hard for me to be well if I don't feel well. And so it's hard for me to feel well if I'm not being well or in a good place to exercise that right to be well. And so both of you, and I want to say right now, conversation is delicious. Thank you so very much. We're going to put the plane in the hangar. That's my saying toward the end. We've got a few minutes, but I want to talk about some right now priorities to improve healthcare. You've mentioned a lot of things, and a lot of things go toward this. Just a couple from each of you. Our right now today in the Black community, what can we do and make priority to improve healthcare? Gail, I'll start with you if you don't mind. Our right now priorities to improve healthcare in Black community.
We have the right to what we pay for. We pay for our health care, and we have the right to be treated as though we pay for it. You're not giving us anything. We don't owe you anything. You're working for us. And if people have the attitude when they go to the doctor that I'm paying you for this service, so you work for me. So you're not doing me a favor by answering my questions. You're not doing me a favor by taking time. We have to empower ourselves to say, if I have a question, you sit here until I feel like I'm comfortable. You can't rush me out. You can't dismiss me. You have to know my name. You have to act like you care about what I'm, and if you don't care, that's fine. Then I'll just work you to the point where I'm comfortable. But we have to demand what we are due. That's it. We just demand what we're due. Nothing extra, just what I'm due.
And one of the things that we have talked about, we have to unlearn some things before we learn some things. We have to be able to help people understand you have the right to demand good service. It
Absolutely.
Doesn't matter who it comes from. You don't have to tear the place up, but they need to know that you are there and that you have a right when you walk in that door for adequate health care. Clysha, what about you? What do you have for us as a right now or a couple of right now priorities to improve healthcare in the Black community?
Definitely that knowledge piece. Just understanding the what goes into being a better advocate for yourself, and also redefining our relationship with food. If you understand that food is meant to nourish you, and it can be good. It's meant to taste good too, but the primary goal is for it to nourish your body. And I think however that looks, and getting help to redefine your relationship, because I don't think it can be done alone at all the times. I think it's a village. It takes partnership. It takes speaking with your family, your friends. Because I'll just give an example. I love Brussels sprouts and I love carrots. Those are like my two favorite healthy things to go to make me feel better. Because I chose to think of healthy foods that when I'm feeling down, what can lift me up. And for some reason, those are so good to me. And so, and now I have friends calling me, taking pictures of their Brussels sprouts that they cooked, or telling me they had some carrots yesterday. And it's just nice to see, like, I spreaded a little bit of that, healthy mindfulness, if it's just one food. And yeah, so I would say those are two, just as we as individuals can do. More knowledge and redefining our relationship with food, and getting some exercise, but really not in the traditional way. Whatever exercise looks like for you, whatever gets your heart rate up. Sometimes I want to do twerk cardio. Other times I want to walk outside, and other times I want to go to the gym. But either way, I'm getting my heart up. I'm exercising for a little bit, at least 2 times a week, I would say. And build and earlier to what Gail said, build on it. I think those are some individual things we can do.
I want to thank both of you so very much for hanging out with me tonight on Wellness Chronicles. We will be talking about healthcare in the Black community for the rest of this month. But it's a conversation that continually needs to be both addressed, and we've got to dig in. So there's some more stuff to talk about But enough for tonight. We've gone as far as we'll go tonight. I do want to say this, Clysha, we'll be expecting to see you more on Wellness Chronicles. This is your second time, I believe, on, and I think it's your third. But you bring so much each time, and so I want to thank you. I wish you the best success as you finish your doctoral program over at UNCC. We need the Clyshas of the world, right, to come on and to help us build community. Yeah, absolutely, absolutely. Gail, I want to thank you so very much. Your first time on, but we'll be seeing you, and we'll actually be seeing you once a month starting in April with Thinking About Nutrition as you come on and help us to do exactly what Clysha just talked about, seafood and our intake of food, our shopping, all of those things in another way where we're actually building nutrition and building wellness. So we look forward to that in April and hope to see you before then. Everybody that's on, I know we have people that watch and sometimes don't join chat. That's more than okay. Please make sure you share. I hope that the last hour was good for you with Clysha and with Gail as we talked about healthcare in the Black community. Very important for our community. I want to thank Kristen and Lisa for hanging out and the comments. Please make sure everybody that's on that you share. Please go to our YouTube channel and subscribe. We're trying to break the bank, get about 10,000 viewers, subscribers by April 1st. This is Wellness Chronicles. I'm Aaron. Had an absolutely great time. See you next week, 6 o'clock. We'll be talking about healthcare in the Black community. And until then, have a magnificently wonderful week. Talk to you later. Thank you, ladies.
Bye.